Hi. Hey. Thank you.
Good morning.
I'm John. I'm one of the day team.
I'm Hannah. I'm night reg.
I'm Emily, one of the day team as well. I'm Julia from the night.
I'm Simon. I'm one of the new registrars.
Hi.
So, I think it's Dr. Stern on today. She's the consultant. She apparently is a bit fierce.
I've heard she's got a bit of a reputation, I'm afraid.
Oh, great.
But it is pretty much 10 past now, so I think if we get started, then we can just kind of miss lots of her.
Oh, I need to get her to watch me do a handover. I need an assessment for my portfolio. Sorry, guys.
Okay, that's fine. No worries.
That's fine.
We'll just wait, shall we?
Sorry.
Is everything up to date?
Oh my goodness, parking in here is
Sorry.
an absolute nightmare. I
Sorry.
swear it gets worse every day.
Sorry.
Right, I suppose we should get started, you guys. We wanted to get going.
Hi, Dr. Stern. My name's Hannah. I was hoping you wouldn't mind doing a handover assessment with me this morning.
Depends if you're any good, doesn't it?
Okay, so Sophie Raymond, she's Pew scoring for tachycardia, but we think that's related to her fever.
Right.
The sickest patient on the ward is Ruben. So he came out of HGU last night with DKA, but he's drinking this morning.
Interesting that you didn't think to call me when you were admitting a patient to HDU.
He's doing well. He's drinking this morning,
Nice.
and similar names. Harry with a Y and Harry with an I are in the same bay together, and they both got chest infections too. And we've moved some patients overnight. Naomi had positive influenza, so she's gone into a cubicle now.
Right.
So Nicholas Morris is he's 12 hours into cefataxime and amoxicillin. He's normally well. 4-month-old who came in hot and irritable, and we've done a full septic screen. The LP showed 3 white cells, no organisms. We're just waiting for blood cultures and PCR results.
Okay, what was his temperature and admission? What's the CRP?
He was 38.2, and I think the CRP was 11 or 12.
You think it was 11 or 12?
Yeah, sorry, I've got
Right, can someone just check? I mean, for all we know, it could be 112.
Well, yeah. Okay.
I'll go.
Yeah.
Right, so why did you start cefataxime? I mean, don't you know there's a guideline?
Yeah, I've seen the guideline, but he's a really small 4-month-old and he was born at 36 weeks, so I didn't know if we could use ceftriaxone, so I thought cefataxime would be safest overnight.
Okay, well, ceftriaxone is actually what you should have used. But anyway, what's the mum's Group B strep result, and what's the baby's serum rhubarb?
I'm sorry, we didn't ask, and I've never heard of serum rhubarb before.
Right, okay, fine. Well, we don't have all day, so TJ?
TJ's 3 years old. He's on 3 hourly inhalers. This is his 3rd admission this winter with wheeze. Mum says he refuses his steroid inhaler at home, and I think she could do with some help with the asthma nurses, and Mum's also a smoker.
Right, so basically it was a social admission then? I mean, could somebody not have taught the parents how to use an inhaler and then we could have let them go home? I mean, we're really tight for beds at the moment. Right, don't answer it. Tell them we're in handover. We can call back
I'll just
later.
answer it quickly. I think it's Amy. Sorry. Hello? Yeah. Sorry, we're in handover. Right. What's Charles' name, sorry? Okay. 10 minutes. Amy. Okay, 1 second. Just in handover. Sorry. Thanks. Sorry, there's a child in Amy. It's been fitting for about 20 minutes. They want someone to go down.
Well, you better go then.
And the final patient is Phoebe. She's 14. She took a mixed overdose last night of unknown quantities, but her ECG was normal, her bloods are normal, and her observations have been fine, so she's medically fit to be seen by the mental health team this morning.
Not another bloody psych patient. Right, is that it? Are we done?
Yeah.
Okay, so how are we going to split everyone up? Right, so you're the reg on for today.
Yeah.
So do you want to go and help with the patient and A&E, make sure they're okay, and get them sorted out? Yeah?
Yeah, alright.
What about you guys? Who's more familiar with the patients downstairs?
I am. I was on the ward last week, so downstairs, so I can do one's downstairs.
Okay,
that's
great.
fine.
So do you want to start in there, and then the Reg will help you when
Just
you
get
get
that teaching.
Sure. Trainee.
Yeah, I've also got some teaching this afternoon. It's from 1 till 3. It's,
Okay.
I have to go to it. It's deanery teaching.
Okay, yeah, you should definitely go to that. The Reg will hold your bleep for you. What's his name again?
Dr. Chakrabarti.
Oh my goodness, who can remember all these names? Right, fine. Is that it then?
Yeah.
So we'll focus on discharges today, please. As you know, we are very tight for beds at the moment. And you can send me a handover assessment for this if you want, but given the quality of your handover, you might want to skip this one, yeah?
Okay.
She's on there all weekend though.